Divya, consultant cardiologist at Aster RV Hospital, Bangalore. Today I would like to talk to you about hypertension. Hypertension means high blood pressure. Blood pressure is the measurement of the blood when it passes through your arteries. So when it is high, it is called hypertension. Why are we talking about hypertension? Because India is soon going to be the hypertensive capital of the world. Nearly 1.2 billion people across the world are diagnosed with hypertension. This is just the tip of the iceberg because many patients do not know that they have hypertension. In our regular OPDs, we see many patients coming to us who have just recorded their blood pressure at home and found that the readings are high. Most of them do not have any symptoms. They reach the hospital only when they have complications like stroke, heart attack, or kidney failure. When we talk about hypertension, I'm sure you would have heard of numbers 120 by 80, 200 by 100, 80 by 60. So what are these? Blood pressure is monitored by two numbers. The upper one is called systolic and the lower one is called diastolic. For all practical purposes and by the 2020 guidelines for hypertension, any high reading above 140 by 90, if your blood pressure readings are above 140 by 90 millimeters of mercury, you are diagnosed as a hypertensive patient. Majority of these do not have any cause. Nearly 90 to 95% of the patients, there is no cause found for the hypertension. This is called primary or essential hypertension. A cause may be found in about 5% of these patients. So this is called secondary hypertension. It can be because of kidney disorders, blood vessel disorders, or other causes like thyroid as well as diabetes or obesity. Many of these patients do not have any symptoms. Most of them come to us with a diagnosis of hypertension or when they buy a new BP apparatus for their parents or their in-laws or any patients at home, and then they routinely check their blood pressure. And when the numbers are showing higher, that is about 140 by 90, that is when they are worried and they come to the hospital. Majority are asymptomatic. Some of them present with headache, giddiness, blurring of vision or kidney problems. Most of them present to the hospital with complications of hypertension, that is stroke, heart attack, kidney failures and even blindness. When do you check your blood pressure? What we commonly tell our patients is, if you are 18 years and above, get your blood pressure checked once. If the reading is in the normal range, check it every 2 to 3 years to be on the safer side. If you are above 40 years or if you are a diabetic patient, get your blood pressure checked at least once a year. If you have other problems like blood sugar, high cholesterol, if your weight is on the higher side, or if you already have a heart problem or a kidney problem, at least once in 6 months, get your blood pressure checked. If you are a known hypertensive patient, check and regularly monitor your blood pressures as per your doctor's advice. Most important in the management of hypertension is lifestyle changes and lifestyle modification. And then comes the medications. Medications will be given to you if your BP is consistently above 140 by 90 millimeters of mercury, or even if during the first diagnosis your pressure is above 160 by 100, because the complications are much higher when you have consistently high readings like this. The most important thing for a hypertensive patient is reduce your salt intake. Decrease the amount of salt when you add to your cooking. Reduce salty foods like papads, pickles, cheese, chips, mixtures, soya sauces. Regular exercise, either walking, jogging, cycling, swimming, or any form of resistance training, 30 minutes of exercise for at least 5 days in a week is recommended. This will keep yourself active, both your mind as well as your body. Reduce your cholesterol levels, reduce your sugar levels, keep your stress levels in check. If possible, try to attend some meditation course or yoga or any fun-filled activity with your family, your children or your friends which will keep your mind engaged. Stop smoking, stop alcohol. The most important thing you should remember is with a good lifestyle, with good exercise, with good diet, with reduction in your weight, stopping smoking and alcohol, you can keep it in check and live a safe and sound life. At Aster RV Hospital, we see regularly quite a number of patients who come with us with high blood pressure readings. We have a dedicated hypertension clinic which takes care of these patients and follows them regularly. As I said, together with your willpower, your lifestyle modifications and with the medications, we can see that hypertension is not a hindrance to your healthy life. Thank you.